So previously we had reported that the AEGEAN study hit its primary endpoints. It has two primary endpoints, pathologic complete response and EFS, or event-free survival. Here we are now doing the analysis at the second interim analysis time point. So it's about 18 months of additional time. And so several key findings. First of all, we can confirm that the broad benefit seen in all the major subgroups at the initial analysis have been maintained now, through that 18-month time point. And now we're past the point where all the patients have gotten all the therapy that they're going to get. When we did the initial interim analysis, about a quarter of patients were still receiving durvalumab. Second major point, we see strong trends in overall survival, and then there's a pre-planned analysis because this study was conducted at the height of the COVID pandemic before we had effective vaccines. There was a subgroup analysis of patients when you exclude the COVID-specific deaths that strengthened the trend seen in overall survival. And then we see improvements in disease-free survival. There were also exploratory analysis looking at patients who did or didn't get the adjuvant part. There was greater relative benefit seen in those who did get the adjuvant part. So that supports that both the neoadjuvant and adjuvant parts are adding benefit. And then finally, there was an analysis here looking at patients who had a pathologic complete response and those who didn't have a complete pathologic response. Interestingly, benefit was seen in both cases, but greater relative benefit was seen in patients who had a complete pathologic response. And that may be counterintuitive for a lot of people because you'd say, well, when you do surgery, if you have a complete pathologic response, that means all the tumor's gone. So there's an idea that maybe you don't need subsequent therapy, but in fact you did.